Healthcare Greenspace is a collaborative project involving the University of the Highlands and Islands, the Forestry Commission Scotland, NHS Forth Valley and NHS Highland. For the purposes of this project, Greenspace is defined as any outdoor, natural environment within or next to an urban area. This can include paths, woodlands, derelict land, old railway lines and parks. Many hospitals and healthcare sites, such as GP practices, have green space outside their buildings or nearby. The main aim of our project is to use best practice from our previous work at Forth Valley Royal Hospital in Larbert to encourage other healthcare sites to use their outdoor spaces in new ways. Through dissemination activities, we will help a variety of healthcare sites to develop long-term plans for the use of their green space. At your site, we will work with your Green Space Steering Group to create an action plan for continued, sustainable use of your outdoor spaces in ways that promote health. But why specifically healthcare green space? Well, we think that Scottish hospital grounds are not currently being used to their maximum potential in terms of health and well-being promotion. People often describe them as being little more than smokers' hangouts, helicopter landing sites, and havens for seagulls. People are becoming increasingly aware that the green spaces around our hospitals do have the potential to be health-enhancing spaces. Places where staff, patients, and the wider community can go to experience nature, to escape for even a little while from the clinical environment, and to relax. Recent research indicates that utilising hospital green spaces for physical activity, nature appreciation, therapeutic activities and social interaction links directly to a number of positive health outcomes that include decreased stress levels, quicker healing times and reduced obesity. Previously, the University of the Highlands and Islands, in collaboration with the Forestry Commission, NHS Forth Valley and NHS Highland, worked to develop and test ways of encouraging people to use hospital grounds for health. This work mainly took place between 2011 and 2012 at the Forth Valley Royal Hospital in Larbert. 3 key groups associated with the Forth Valley Royal were directly involved in the project: hospital staff, residents from the local Larbert community, and a cardiac focus group made up of clinicians and patient representatives. These groups took part in a series of 3 workshops led by the UHI team. Workshop activities included community-based mapping, prioritisation exercises, and led site walks. The workshops were complemented by drop-in events. We created a participation booth in the front lobby of Forth Valley Royal, where people could stop by to tell us how they used the grounds or what improvements they would like to see. Maps and suggestion boards were available 24/7 for people to add their ideas. An online survey of hospital staff was also carried out in order to include as wide a range of staff views as possible. By understanding how the groups currently use their hospital green space, what stopped them using it more, and how they would like to use it differently, we were able to identify improvements and activities that would encourage people to use the outdoor space. The staff and patients groups were most keen to use the grounds for mental health benefits. For example, the cardiac workshops identified the potential for rehabilitation patients to use the outdoor space in order to reduce stress. This was developed into an intervention programme by the NHS cardiac team and the Forestry Commission. It was implemented as the UK's first outdoor woodland-based recovery programme for cardiac patients within hospital grounds. Patient participants reported experiencing improved mood, better physical health and wider peer networks. The community members that we spoke to viewed the hospital grounds as a potential part of the public green space that is available locally, but they also welcomed organised events being held in the space. One of the activities taken forward was a weekly programme of Tai Chi classes for both members of the local community and NHS staff. The Healthcare Greenspace project team would like to provide you with the resources to carry out your own workshops. As part of our dissemination, we will demonstrate how participatory mapping workshops can be used to create maps of local knowledge about hospital and healthcare grounds. Together, we will create maps that show patterns of current use, what you like about your outdoor space, and also potential improvements for different groups of users. You will then be able to carry out your own mapping workshops to capture even more opinions from other staff, patients, and community members. You could also run a walks workshop. It's a doddle. Why not set up your own participation booth in a prominent place, such as near the main entrance? Past experience has shown that the use of an online survey or questionnaire can be useful in capturing the opinions of staff who work shifts or at multiple healthcare sites. The UHI team's main task is to facilitate and support the decision-making processes of the key groups at your site. It is expected that the key groups will themselves drive forward the design and implementation of their own programmes. But with the help of the Forestry Commission and the NHS, we will assist you to design an action plan for making this happen. We will host a workshop specifically for managerial staff to discuss some of the barriers to green space use, and, together with the Forestry Commission, can provide training in outdoor and conservation activities. If you like, you could come to one of our dissemination events at Forth Valley Royal to see that green space for yourself. Let us for a moment consider hospital grounds as a form of therapeutic landscape, as outdoor spaces that promote physical and mental health. As such, we can imagine both active and passive activities taking place, such as walking with patients, photography, wildlife watching. We can consider it as providing an alternative or a contrast to the busy life of the hospital, where it provides opportunities for relaxation, escape, breaking up of the day, a time to think, a time to clear your head. The grounds can be seen as being part of a wider network of green spaces. Such a landscape can trigger therapeutic experiences linked to individual or community nostalgia by invoking memories of past usage, house, of garden and childhood. But at the same time, we must be aware of real and perceived organisational barriers, such as smokers, uniforms, legitimacy of use. In previous work, staff perceived the attitudes of their managers and restrictive hospital policies as complicating their access to the green space during their working hours. But this turned out to be more a problem of perceptions. Our previous projects have clearly shown that creative, participatory methods were highly valued by the project participants and proved very useful. By adopting a participatory approach, in other words, working in partnership with stakeholders like you, we have co-designed intervention strategies to meet participants' health goals, and that they were motivated to take part. So let's work together to consider how your healthcare green space can be used to promote health.